Friends, you must have heard stories of how somebody took a tablet of paracetamol and had some side effects. Or you must have also experienced bad effects of drugs or even allergy to drugs. People always confuse between side effects, adverse effects, allergy, and toxicity to the drugs. And this is a very sensitive topic, and today we'll be discussing about the drug side effects, adverse effects, allergic reactions to drugs, and toxicity to drugs. I am Dr. Prasad Onam, consultant physician. Let us first see what is meant by a drug side effect. Drug side effect is actually effect of the drug which in that particular person in which it is given is not intended. But because a drug is given, the body has to suffer or face all the effects of the drugs. So the desired effect of the drug is the effect of the actual defect that we want, and other effects that the drug produces become side effects. I will give you an example. There is a drug called atropine. It has many effects on the human body. One is to increase the heart rate. The other is to cause dryness of mouth. And third is to dilate the pupils of the eye. Now when it is given to increase the heart rate, this drug will also by default cause dryness of mouth and dilatation of pupils. You will find it difficult to focus. Now when the desired effect is increasing the heart rate, dryness of mouth and dilatation of pupils become the side effect. Sometimes this drug is given to produce dryness of mouth. In that situation, increase in the heart rate and dilatation of the pupils become the side effects. And sometimes this drug is given to dilate the pupils, when the other two effects become the side effects. So side effects are predictable. Most of your doctors, most of the times will tell you that if you are taking this drug, you are very likely to face this side effect. Most of the times, side effects are mild, though at times they can moderate or in fact severe enough to cause either adjustment in dose or stopping the drug altogether. Some of the side effects are even beneficial. For example, there is a drug which is used in diabetes, which can also cause reduction in weight. So this effect, which is the side effect of the drug, is actually a beneficial effect. Most of the side effects are extremely mild and will not force a doctor to stop the drug. And another thing, most of the times the side effects will be, as I told you, predictable. I have already told you the side effects and effects of a drug called atropine. A very commonly used drug is Benadryl. Now whenever you take Benadryl or whenever your doctor prescribes you Benadryl, he will invariably tell you to be cautious while driving because this drug can cause drowsiness. Benadryl side effect is drowsiness. Another example is there is a drug which is used in hypertension. This drug can cause reduction in heart rate. So that becomes the side effect of this drug. This drug called Undesirable is sometimes given to reduce the heart rate when reduction in blood pressure becomes a side effect. Next, we will see what are the adverse reaction or adverse effects of the drug. Adverse effects are unexpected and they are harmful to the body. That is not true with side effects. Side effects can be sometimes even beneficial and side effects are predictable. Most of the doctors would know that this drug will have this side effect. Adverse reactions or adverse effects are always unpredictable and always harmful. Now, if you take one tablet of paracetamol, some of you will develop adverse reactions like gastric irritation, but most of us won't have any problem. So it is unpredictable who will have adverse effect or adverse reaction to a drug and who would tolerate the drug properly. Another thing about adverse reactions or adverse effect are they are generally mild, but at times they can be serious enough to force discontinuation of the treatment. And most important thing, adverse reactions or adverse effects can never be beneficial. What are the examples of adverse reactions or adverse effects? Many times we take tablets, painkillers such as Combiflam. Some people will have some gastric irritation, some nausea. Some of them may even have vomiting very rarely. But many people will have this gastric disturbance. This is an adverse effect of the drug, never beneficial. Many times we have experienced that if we take antibiotics for 3-4 days, we develop loose motions. So this is also adverse reaction to antibiotics. This happens because antibiotics kill bacteria. And when antibiotics enter the intestines, they kill bad bacteria as well as good bacteria. And when good bacteria are killed, we start getting loose motions. So this is an adverse effect of antibiotics. Many times people who take antihypertensive drug called Undesirable may develop asthma-like symptoms. They may find breathing difficult. This is an adverse effect of propranolol or Undesirable. Sometimes a very frequently taken drug crocin can cause skin rash. Now this skin rash is always adverse reaction to crocin. A very commonly prescribed antibiotic, Norflox, can cause dizziness and headache. So if we compare the side effects with adverse effects, side effects are predictable, they can be beneficial at times, they are generally mild, whereas adverse effects are always harmful, they are unpredictable and sometimes can be severe enough to necessitate the discontinuation of the treatment. Now let us come to what is known as drug toxicity. Drug toxicity is developed when large amount of drug accumulates in the body and the drug levels go beyond what are acceptable levels. When this happens, the drug starts causing very unpleasant and sometimes very serious effects which are called as drug toxicity. Drug toxicity happens when you take too much drug for too long a time. Sometimes people take large amount of drug at one time, like people take 8, 10, 20, 30 tablets of sleeping pills. The intentions are either suicidal or homicidal. Drug toxicity that develops, that we are talking about, is unintentional, where doctor gives you a drug for a long-term disease like hypertension or heart disease, where drugs have to be taken for years together. And because the drug is taken for a long time, it goes on accumulating in the body and then starts causing toxic effects. So this is unintentional. Against intentional toxicity, when you take a huge amount of drug at one time to cause self-damage. Drug toxicity will always need intervention. Either it will need stoppage of the drug, adjustment of the drug, or at times even giving another drug to neutralize the toxic effects of this drug. Many times drug toxicity appears because body is not able to metabolize drug as fast as it should. Because body is very slowly processing this drug, the drug levels go on rising and toxic effects appear. Sometimes people take drugs like non-steroidal anti-inflammatory drugs such as ibuprofen without consulting the doctor. They take it for a long time. If this drug levels in the body reach toxic levels, then these persons can have renal damage and that can be really life-threatening. Many drugs, many painkillers can cause fall in WBC count. Sometimes even they cause complete bone marrow failure also. So this is also a very serious toxic effect of taking drug for a very long time. Examples of drug toxicity, as I have told you, too much of paracetamol, which is available to us as crocin or calpol, too much of it can cause liver damage. Too long a treatment with drugs called non-steroidal anti-inflammatory drugs such as naproxen, ibuprofen can cause renal damage or kidney damage, and many times these drugs can also cause bone marrow failure. Many times hear people saying, I am not taking aspirin because I am allergic to aspirin. And when you ask them what happens if they take aspirin, they will say, oh, I get stomach upset. No, this is actually not allergic reaction to aspirin. This is actually an adverse reaction to aspirin. Aspirin causing gastric irritation. And that's why this person has upset stomach. So what is actually drug allergy? When body's immune system reacts against the drug, that reaction is called as drug allergy. It is said that anything and everything under the sun, including the sun, can cause allergy. So there is no drug which cannot cause allergy. So you must be aware of this fact that any drug you take, from simple paracetamol to very high level antibiotics or other drugs, any drug can cause allergy. Allergy can range from very mild effects like rash, some itching, some pigmentation, to sometimes very severe reactions which can be life-threatening, such as anaphylactic shock or toxic epidermal necrolysis. Commonly, people are allergic to antibiotics, to drugs like aspirin, or the drugs which are derived from animal sources like albumin people are very likely to be allergic to it. We also find people very frequently allergic to procaine penicillin or sulfur drugs. But on the whole, allergy to drugs is a rare phenomenon. The last thing that we will see is drug idiosyncrasy. As the name suggests, idiosyncratic reaction is a bizarre reaction that can occur even after a single tablet of the drug. It's always harmful. Most of the times it is quite serious, and most of the times it will mean you cannot use that drug ever again. Simple drug called that we take, we have discussed many times, paracetamol or a sulfur drug, can cause a very serious syndrome called Stevens-Johnson syndrome, which can at times be very serious. And this is an idiosyncratic reaction that can occur with the first tablet of aspirin or first tablet of paracetamol. People very commonly are taking drugs to reduce the lipid levels called statins. These statins can cause severe muscle damage even with one tablet. That is idiosyncratic reaction to statins. So what is the take-home message of this video? Never take a drug unless prescribed by a doctor. Number 2, remember, even over-the-counter drugs can have side effects, can have adverse effects, and can cause allergy and can be serious. So taking drugs very casually is always dangerous. Most of the side effects and adverse reactions are mild. But if you experience an adverse reaction or a side effect, please inform your doctor immediately, because he may find it necessary to intervene, either reduce the dose or stop the drug altogether. Do not take drugs for a long time, especially painkillers, when doctor has not prescribed you. Some people have a habit of just taking one tablet of a painkiller every day just because they feel better. Don't do this, because in long term it can cause serious damage to your kidneys. Never take antibiotics without doctor's prescription. We have seen this many times, that one member of the family that gets fever, so he goes to his doctor, the doctor prescribes him some antibiotic. Then after few days, after many months, another member of the family gets fever. And then there is a discussion that when this man had fever, doctor gave him azithromycin. Let's go to chemist and buy azithromycin and give azithromycin to this person because he also has fever. Never do that, because number 1, fever may be because of different reasons. Most of the common fevers do not need antibiotics, and antibiotics must always be prescribed by the doctor, never to be taken as over-the-counter drugs. When someone claims that a particular drug has no side effects, take it with pinch of salt. If drug has no side effect, then it is possible that this drug has no effect in the first place at all. Thank you very much, friends.